segment is sponsored by Virginia Physicians for Women.
Mammograms offer doctors the chance to have a closer look for changes in breast tissue that often cannot be felt during a breast exam. But just how important is a mammogram, and really how often should you expect to have one done? Dr. Maria Meussling with Virginia Physicians for Women joins us this morning to answer those questions. Maria, it's nice to have you.
Thank you. I'm happy to be here.
Thanks for coming in. You know, we were talking a little bit before we got started this morning about revisiting this idea because there's been a lot of confusing information that's come out about where, when, how. Can you enlighten us?
Absolutely, absolutely. So for women, it's incredibly important to be getting your mammograms annually. We encourage women to start at age 40. Some women will need to come in sooner depending on risk factors and after consultation with their physician. But really annually mammograms starting at age 40 are the way to go. Breast cancer, is so prevalent. It affects 1 in 8 women, or 12% of women are going to be affected by it at some point in their lifetime. It's the second leading cause of cancer death in women in America. And so the best way for us to find that is to do mammograms every year. If we can find it early, if we can treat it early, most women can actually be cured. It doesn't have to be, a long drawn-out course. So that's really what our goal is to get women in early before they start having any symptoms or signs and start screening right away.
And the age of 40 is pretty much accepted as that getting in early and getting a head start.
Absolutely, absolutely. The American College of OBGYN, the American College of Radiology, any medical society that has any expertise in breast health has all recommended age 40.
Now, we come in and we're going to have the mammogram done. If you've not had it before, honestly, you hear some horror stories about what it can be like. What can you expect from the doctor's perspective? What should a patient expect?
Right, definitely. So, mammogram is a dreaded experience. I mean, unfortunately in my field, the pap smear is a dreaded experience, mammogram's a dreaded experience, and we really want to make that as comfortable and as relaxing as possible. And what's so exciting about our office now offering mammography at our Innsbruck location is that we've really tried to make that a more convenient and relaxing experience for patients. So, it's an easy location, it's convenient, the parking is easy, the check-in process is easy. We have we call our warm white robe package, which we just really wanted to make it a little bit more of a spa-like experience for women so that all that pressure and anxiety is kind of taken down a notch.
We're seeing some video now of that new space at the Innsbruck location. Of course, Virginia Physicians for Women has many locations throughout Richmond, but this new mammography suite is at the Innsbruck location.
Exactly. And what's great about that, too, is that, it's not attached to a hospital. And so, you avoid that hustle and bustle of, the issues of being in a hospital or in the hospital setting. Like I said, parking's easier. The other thing that's great is that the physicians there are dedicated to this freestanding facility. We're not going to be getting pulled away to do emergencies or deliveries. We're really just there to take care of the patients who are there.
And that's the big differentiator, because you may think, wait, it's not necessarily tied with a hospital location, but it's so you can focus on the patients and you don't get distracted by going to cover those other responsibilities.
Absolutely, which is great from our perspective too, because we don't like running behind, and we don't like the stress of having really to deal with all of that at the same time and having to prioritize. Especially for me, I like to run on schedule. I respect that patients have other things going on. Women are busy. We don't have time to be waiting in waiting rooms for hours and, getting a quick visit. So,
especially now for something that you weren't looking forward to before the white robe treatment, of course. You also have quickly a soft pad experience as well that helps with the comfort.
Right, absolutely. So with a traditional mammogram, there will be basically 2 usually plastic plates that are going to compress the breast. What we use is is what's called a softer mammo pad, which just basically kind of puts a cushion between the breast tissue and the actual plates, which makes it more comfortable. It also helps the technologist to get a more accurate reading. So it's beneficial all the way around.
Fantastic. Dr. Maria Meussling, thanks for sharing with us today.
Absolutely. Thank you for having me.
Appreciate it very much. You can learn more about Virginia Physicians for Women and the new mammography suite. Call 897-2100 or visit online VPFW.com. The new mammography suite is part of the Virginia Physicians for Women's Innsbrook location at 7605 Inns Lake Drive, Suite 307 in Glen Allen.